Hi, it's Nora Bachman, pediatric physical therapist in Santa Monica. One of the questions that I get often, particularly with the younger pediatric population, is when do I see OT, when do I see PT, what's the difference, and why would I take my child there? So it's a lot of big questions. Essentially, when you're talking about a baby or a very young child, there's actually a lot of crossover between physical therapy and occupational therapy, primarily because kids aren't doing a whole lot when they're just born and during the first few months of life, and sometimes even into that first year. There's a lot of the same skills that both OT and PT bring to the table. So oftentimes a physical therapist is recommended with a young baby, particularly if you see a diagnosis like torticollis, where a neck muscle is tight and the child's range of motion is limited, or when you're just seeing kind of a developmental delay, which is generally just a general category to describe a baby or a child who's not performing skills that a typical child of that age would perform. A lot of times you'll hear it's a wide range, what's normal, it's different for each child, and that can be kind of frustrating as a parent, but unfortunately it's because it's true. So typically when I get a referral for a newborn or a baby, I'll do a pretty thorough diagnostic evaluation to try and determine what's keeping that child from meeting whatever milestone it is. And I'll bring in an occupational therapist. I'll speak to a friend or make that referral. Usually when I see a challenge with feeding, a lot of occupational therapists can be specialists in feeding, but you should make sure to check, because not all occupational therapists are specialists in feeding. And you also want to see, do they specialize with babies or toddlers, because it's very different with feeding at different ages. I'll also look to an OT for support if I'm noticing a lot of social emotional dysregulation. So babies obviously have big reactions. That's part of what makes them babies. But when I see a baby having a really big reaction to something small, when it happens a lot and when they have a very hard time calming down, that's when I'll often sense that there might be something more going on than just regular baby behavior. It's normal for a baby to scream and cry when there's a fall, when there's a loud sudden sound, even when they feel a shift in their caregivers around them. However, when it's something very small and they're having a big reaction, I'll often turn to my occupational therapy colleagues to ask those questions and make that referral.